Feeling stressed, overwhelmed? It's time to unstress your life and focus on controlling what you can control. I'm Dr. Ron Ehrlich, host of the Unstress Health podcast, inviting you to join the Unstress Health community and discover a holistic approach that helps you more effectively face the daily challenges of our modern world and effectively recover each and every day. Unstress Health is here to provide you with advice and support that is independent of industry and influence, an influence that's easy to miss but difficult to ignore. Our focus is on building mental fitness. Your mind can be your best friend or your worst enemy. Mental fitness is the key. Our three-phase approach targets mindset, boost your positive intelligence quotient, and move from self-sabotage to self-mastery. Secondly, the challenges. We redefine what stress means in our modern world. And thirdly, recovery. Master the 5 pillars of health. As a member of the Unstress Health community, you'll turn obstacles into opportunities with expert-led courses, curated podcasts, personalised health assessments, a supportive community, and much, much more. Join Unstress Health today, and together, let's not just survive, but thrive. Click on the link below or visit unstresshealth.com. Well, today I have the pleasure and the honour of welcoming back to the program Dr. James Muecke. James, it was Australian of the Year in 2020. He was awarded that for his social impact organisation Sight for All, which creates low-cost programs to fight blindness through research, education, infrastructure, also raising funds to deliver eye health care projects free overseas to partner countries and communities and train colleagues there in new sight-saving skills. Well, that was what James was awarded the 2020 Australian of the Year. And in that year, which many of us may recall was the beginning of the pandemic, and as an ophthalmologist, he decided that he would focus on diabetes because one of the tragic side effects of diabetes is loss of sight. And he shares with us a very harrowing story in this program. But James, well, if he achieved Australian of the Year for work he had done prior to 2020, I think he may well deserve, along with Dr. Peter Bruckner, who will be has been on the program before and is on the will be joining us again in coming episodes. These two have championed a low-carb approach to treating type 2 diabetes. Now, to anybody who has received a diagnosis of type 2 diabetes, from the vast majority of the medical profession will be told they will be on medication for life, that remission is not an option. And as you will know as a regular listener of this program, that is simply not true. There is remission for type 2 diabetes, and low-carb approach and healthy fat approach is really a breakthrough in this. And together, Defeat Diabetes was founded by Peter Bruckner. I'm very proud to have been a supporter of that. But James Muecke has been an ambassador for Defeat Diabetes, and I believe one of the greatest public health initiatives in over 40 years in Australia has just occurred, and that is the collaboration between Diabetes Australia and Defeat Diabetes. And this is a groundbreaking collaboration, and James Muecke and Peter Bruckner have been working tirelessly to champion this. So I was very keen to get James back on to give us an update of what has happened in this very important public health initiative. I hope you enjoy this conversation I had with Dr. James Muecke. Welcome to the show, James.
Ron, great to be back again. It's been a few years.
Yes, I should say welcome back, because we spoke just after you became Australian of the Year in 2020, which, was wonderful, except 2020 wasn't perhaps the best time, just as the pandemic was breaking, to pursue the passion that you have pursued then and since. Tell us what that passion was all about and what drove it.
Yeah, well, actually it dates back to probably 2018. And as an ophthalmologist, what I'd noticed over the 30-odd years of my career was the rise in type 2 diabetes particularly, and the rise in the number of patients that I was seeing, that I was treating with vision-threatening, what we call diabetic retinopathy or diabetes-related eye disease. But it perhaps came to a head when I, in the middle of 2018, I think it was, decided to undertake a little documentary. It was going to be a series of talking heads, talking portraits. And I interviewed a number of people who were blind, really to get an idea as an eye surgeon, as an ophthalmologist, what it means to be blind. And I interviewed 4 kids who had been born blind, who all had fascinating stories. I interviewed 4 people at the end of their life that were going blind very slowly due to age-related macular degeneration. And their stories weren't so impactful because they adapted to their deteriorating vision. They had support from their families, and they were managing quite well. But the two patients that I saw who had a deep impact on my thinking about all of this were 2 people in the prime of their life who went blind in both eyes due to their diabetes. And particularly a guy called Neil Hansel. He's happy for me to use his name. Neil tells this harrowing story of going to bed one evening with normal sight at the age of 50 and then waking up blind in both eyes the next morning. And he's blind to this day. So his story was incredible. I remember at the time I was in tears. He was in tears. The movie, the filmmaker, the cinematographer, the sound engineer, everyone was in tears over this harrowing story that this guy was telling. And I used Neil's story to then ultimately create a TV commercial which aired nationally on Channel 7 in late 2018, encouraging people to have their eyes checked. You know, the reality is there are probably close to 150,000 people in this country with sight-threatening eye disease due to their diabetes.
Wow.
Overall, there are about 2 million people in this country with diabetes, the majority of whom have type 2, but well over half are not having their regular, all-important sight-saving eye checks, and that's why it's become the leading cause of blindness amongst working-age adults in this country. It's also the fastest-growing cause of vision loss in Aboriginal people. So in 2018, or after that amazing experience I had, I felt our charity, the charity that I'd co-founded called Sight for All, which had a focus in Asia, which is home to 2/3 of the world's blind adults and half the world's blind children. Our focus has been in Asia, but I also felt a deeper responsibility to focus on what was happening here in Australia. We've always had an Australian arm, but I just felt that it needed more focus, excuse the pun. And so we held a fundraising dinner in 2019. We used Neil and his story to help drive awareness around this need to have eye checks. And it really rolled on from there. And fortunately, I was nominated as South Australian of the Year. I wasn't expecting to win that award, but I did. That was in late 2019. And then going on to the national awards in early 2020, I thought, well, okay, if I'm going to win Australian of the Year, I'm not expecting to, but if I'm going to win it, what is Australia's biggest health crisis? Because surely I have a responsibility to tackle that, being a doctor. And so I felt strongly that it was type 2 diabetes. If you consider that close to 2 million people in this country, of roughly 25 million people, have type 2 diabetes that we know about, then this is where I should be focusing my energies. And so I started doing a lot of reading and reaching out to people who were able to mentor me and guide me through this process. And when I won the award in early 2020 on the Australia Day weekend, I talked about sugar being a driver of this, and I still believe sugar is an important driver of this, but I realized that it's actually more than just sugar. My journey went on this amazing trajectory from that time.
Well, you know, I did see the documentary, and I think it is compelling, emotional, confronting, shocking, very powerful. And I will have links to it, of course, for people to see that. But I'm interested on another level, on a professional level, on a personally professional level, because you've been a doctor for 30 plus years. That's fair to say, James?
Well, I've been in the medical profession for 40 years now,
40
over
years,
40
okay.
years, which is scary. In fact,
Okay.
I'm on the brink of
I know.
retirement, but in the
Yeah.
ophthalmic profession for 35
Yes,
years.
yes. And you've been observing type 2 diabetes, you've been observing all the eye problems and specifically type 2 diabetes as well. And for advice on what causes type 2 diabetes, you would, of course, just naturally go to Diabetes Australia or the Australian Healthy Eating Guidelines, because I'm not sure how absorbed in the study of nutritional medicine you were on your professional journey. Would you share that with us?
Yes, I would. It's fair to say that I'd had very little idea at all about nutrition science and the non-science, which often drives this whole space. So no, I was very naive. I always thought my role was the guy at the end of the line to treat the end-stage complications, the blinding complications, the most feared complication of diabetes. So that was my role. I never thought of my role as being one that to talk to my patients about their lifestyle, specifically about their nutrition and what was driving their type 2 diabetes. And if you look at as late as 2021, the very first line on the type 2 diabetes webpage of Diabetes Australia was type 2 diabetes is a progressive disease. And they go on to mention the word progression or progressive several times on that one page, and that ultimately patients will need to go on medications and insulin, and then experience complications. So it was basically, once you developed type 2 diabetes, it was a done deal. You had this trajectory that you were going to be on. But what I realized probably wasn't until late 2019, 2020, early 2020, when I was reading around this subject. I think it was probably even in the Christmas break in 2019, 2020, leading up to the Australia Day weekend, that I read a number of books. One of the most powerful books that I read was a book called The Diabetes Code by Jason Fung, who's a renal physician from Canada. And I found out that type 2 diabetes could be reversed naturally through diet. So this was absolutely news to me, and it was an extraordinary revelation. And then in 2020, because of my advocacy, because of my Australian of the Year appointment, I was asked to be on the expert advisory group for the National Diabetes Strategy refresh. And I was able then, as part of that process, to get remission of type 2 diabetes into that document for the first time. So that was, I think, a big, big hurdle, which has really allowed a whole bunch of things to happen since that time.
Yes, and we want to talk about it because some of those things that you've been involved with, I would have to say, are probably the most positive public health initiative in 40 or 50 years in Australia. And we're going to come to that. Spoiler alert, we're going to come to that. But I still want to stay with you as a practitioner, because this is part of what the big problem is. You're a busy medical practitioner. You have faith in public health authorities and public health documents, specifically the Australian Healthy Eating Guidelines, which I have to say, I walked into a childcare centre picking up my grandchildren just a few days ago, and there was the Australian Healthy Eating Guidelines. And you referenced Diabetes Australia, who I remember reviewing their 10 steps for leading life with diabetes. And step number 1 of the 10 is ensure carbohydrates are part of every meal and stay on a low-fat diet. And when I read that, I realized the key word there was with diabetes. If you wanted to live life with diabetes, you would follow that advice. But if you wanted to live life without diabetes, you wouldn't.
It's amazing.
I mean,
and fortunately, Diabetes Australia is moving in the right direction, which is exciting.
Yes, that's
come
very
to
exciting. Very exciting.
But
but then, yeah.
I was just
But you've go on.
during medical school, as I mentioned before, there was no talk about nutrition, and particularly specifically the appropriate nutrition pathway that people would need to be on to prevent prediabetes, type 2 diabetes, the underlying metabolic dysfunction, which is insulin resistance. My son, who's in 6-year medical school at the moment, he was in 2nd year medical school a few years ago, and he had the opportunity to do nutrition science as an elective. So it's not even compulsory in most of our medical schools here in Australia. And yet our poor diet is responsible for more disease and death than smoking, drinking alcohol, and physical inactivity combined. So it's troubling that doctors, from general practitioners through to specialists and beyond, are not receiving this really important, critical information which could turn around a chronic disease epidemic.
And I know that you've been an advocate for this change. Tell us the message that you are essentially trying to convey to the authorities and to the public as well.
Yeah, so there's a number of messages, but I think the critical one, if you look at the dietary drivers of type 2 diabetes, they are sugar, particularly the fructose element, and refined carbohydrates, which are essentially sugar in disguise, starchy products such as highly refined white flour, white rice, peeled white potatoes, and the foods prepared from those. And the seed oils, what we euphemistically call vegetable oils, but they're made from seeds such as sunflower, safflower, etc. And if you realize that ultra-processed foods, which the major components of most ultra-processed foods are sugar, refined carbs, most often highly refined wheat flour, and seed oils, then you realize that ultra-processed foods are clearly not good for our health. And there's been a recent systematic review released in the British Medical Journal this year linking ultra-processed foods to a number of chronic diseases, including type 2 diabetes. So my message is around about preventing metabolic dysfunction, and type 2 diabetes is really just the end stage of that continuum of metabolic dysfunction, which starts with insulin resistance. So preventing type 2 diabetes through changes of diet, which essentially is avoiding sugary drinks, sugar added to our foods, foods with added sugar, particularly ultra-processed foods, and foods containing or deep fried or cooked in seed oils. And if most of us were to follow that advice, then the chance of ending up with type 2 diabetes would be very small indeed. Now, the other thing which has become a really important part of my messaging, which started back in 2020, was the opportunity to put type 2 diabetes into remission. And as I mentioned, I was able to get that very important message, a very important piece of information into our national diabetes strategy for the first time. And so when I was able to get that, and that was published in 2021, I then started chatting to my patients, because before that, there was this uncertainty whether you would get reprimanded by our medical board for having these conversations with patients. Certainly, there are examples, and Gary Fick is an excellent example of a doctor, a colleague, a specialist colleague, an orthopedic surgeon, who was actually prohibited from practicing his profession for 2.5 years while he had an investigation simply for advising his patients to cut back on their sugar intake. Because he was just finding that he was amputating so many feet and legs for patients with type 2 diabetes down in Tassie. And that's a fascinating story, as you know.
Well, Gary was the second guest or third guest on my 400 episode podcast, and his wife, Belinda, who's also an advocate for this. That is a shocking, compelling, and confronting story for healthcare in general and practitioners in particular. So yes, Gary has been a guest on this program, and so is Belinda, conveying the trauma that they went through and conveying a message like you are doing now, not just as Australian of the Year, but actually making change.
Yes, absolutely. And I mean, Gary's story is extraordinary and disturbing. But the good thing is, now that it's in our national diabetes strategy, there's no need for doctors, dietitians, nutritionists to fear being reprimanded by their overseeing bodies, because it is in our national diabetes strategy. It is under one of the major goals of our national diabetes strategy. So I was just mentioning, so once that was in our national diabetes strategy, I started having the conversation with my patients. Did you realize that your type 2 diabetes could be put into remission? Only one of the first, let's say, 100 patients who I had the conversation with was even aware that their diabetes could be put into remission. I'm talking about type 2 diabetes here. Only one of the first 100. And these were patients who had sight-threatening eye disease, who I was actively treating. I have a much broader group of patients who I'm just watching to ensure they don't develop type 2 diabetes, what we call background diabetic retinopathy, or patients with background diabetic retinopathy that I'm watching to make sure that they don't develop sight-threatening disease. I'm talking about the patients who actually had sight-threatening disease, who I'm actively treating. So what I then did was, okay, what we need to do is make your GP aware of this amazing opportunity. So I'd write back to the GP of the mutual patient saying, can we explore this incredible opportunity to put our patients' type 2 diabetes into remission? And amazing bunch of results. And I would copy the endocrinologist in if the endocrinologist was, if the patient actually had an endocrinologist, and specifically if they had an endocrinologist that I was able to communicate with and I knew. So most of these letters, as far as I can tell, were ignored. Occasionally, patients, and I recommended a local nutritionist in Adelaide who I was aware of that was able to guide patients through their journey to put their diabetes into remission. So I recommended a local nutritionist, and a few of the GPs, and took this on board and sent the patient to the nutritionist. Unfortunately, a lot of patients couldn't afford nutritionists and dietitians that are able to put type 2 diabetes into remission because it's not covered by Medicare. It ends up being quite an expensive thing for them. And so some of them went alone in this journey. And some of the patients actually insisted that their GP, explore this opportunity for them. And then what I did was see patients coming back. And these were patients that I was injecting in their eyes with an antibody to try and save their vision, stop them going blind. And I still remember the very first patient that came back to me, a guy called Bevan Bruce. He's also happy for me to use his name. So Bevan, he was having 2 monthly injections in both eyes, had been for years. And I was unable to wean him off these injections. And he came back. Initially, he'd come off his insulin. He'd seen the nutritionist. The nutritionist was guiding him on basically what we call a ketogenic diet, a very low carbohydrate diet, avoiding those products which I mentioned before, including seed oils. So Bevan came off his insulin pretty quickly. He'd been on medications for 10 years or more. Then he came off all his medications. In the process, he lost a bunch of weight. He then said he had never felt better. And ultimately, he said he also was starting to see better. And what I've found over the next 2 or 3 years was that I was able to slowly wean him off the injections, so much so that he's now off his injections entirely. His type 2 diabetes has remained in remission, and his macula, I was treating him for diabetic macular edema, the most common cause of vision loss in patients with type 2 diabetes. His macula has remained normal. So it's super exciting. It was a super exciting thing for me to experience as a doctor, and something that I wish every one of my colleagues would also have the experience as well. And, I'm just in this little silo of ophthalmology, and I'm seeing this one complication. And we're seeing this again and again throughout all the specialties of patients who put their type 2 diabetes in remission. The side effects, the potential complications are also potentially reversing. I mean, unfortunately, if the damage is severe and it's been long-standing, it's not so easy. We won't see. We might see a stabilisation of the situation, but we may not see reversal of the damage that's been done.
But I can only imagine how that must have felt as a physician specialist who for 35 years had been managing disease, to have cured, maybe cured isn't the right word, but putting into remission is almost a word for cured. Let's call it remission, putting disease into remission where the patient no longer requires medication treatment and actually expresses the fact that they feel better than they ever have. How did that make you feel as a physician after 35 years, James?
Oh, it still is the single most exciting moment of my 40 years in medicine. This one particular patient. Now, I've seen this being repeated time and time again, but this first experience was just so heartening for me. And what I've noticed, I'm now about to publish a case series, and I've got at least 30 odd patients we've seen a reduction in their macular edema. We've been able to get a number of patients off injections altogether, or at least reduce the frequency of their injections. Even patients who were not receiving injections who have put their type 2 diabetes into remission. We've just published a case study of a young woman, middle-aged woman actually, who had type 2 diabetes, and within a couple of weeks she came off her insulin once she started on this dietary change. And over a 9-month period, she was borderline. She had macular edema. She was borderline requiring treatment, and probably a year or so ago, a couple of years ago, I might have started her on treatment. But because we were going down this pathway of dietary change, and very quickly she put her type 2 diabetes into remission, well, I thought, well, let's just see what happens to her macular edema. And over a 9-month period of time that I was watching her macula normalized again, but just not requiring any treatment beyond a change in diet. And we've just published that study, and I've just put that out on social media. Super exciting to see this change because of a change in dietary consumption.
Do you know, to just juxtapose your excitement with another episode we've done recently on burnout in medicine, I shared a statistic that 44% of doctors and 60% of nurses suffering from burnout. And I can only imagine how draining constantly managing and writing disease and prescriptions must be, and overwhelming. And yet here you are, after 40 years of practice, more excited than ever before. Far from burnout, I would suggest.
Oh, I've been absolutely buoyed by this experience. And speaking to a number of my colleagues, I'm sure you're the same, Ron, but Laureen Lawler-Smith, who's a GP here in Adelaide, she is a low-carb practitioner, and was getting towards the end of her career and really very burnt out and disillusioned, just treating chronic diseases, alleviating symptoms, prolonging life perhaps, but ultimately not very satisfied. And then when she learned about this opportunity and started using it with her patients and seeing the turnaround in the metabolic dysfunction, the improvement in metabolic health, the remission of type 2 diabetes, the reversal of prediabetes, et cetera, she also has given her a new lease of life in her own medical career. So we're seeing this time and time again of medical practitioners who start to go down this pathway and see and experience this, and it's absolutely revitalizing.
Because at the end of the day, and we've done programs on autoimmune, cancer, heart disease, obviously diabetes, lowering insulin level is a common denominator in making everything better.
Absolutely. So unfortunately, insulin is a critical hormone in our metabolism, but if it's persistently high, the level in the blood, hyperinsulinemia, which is ultimately caused by insulin resistance, then the high level of insulin in the blood can drive, it's inflammogenic, so it drives inflammation. It's thrombogenic, so it drives the formation of plaques in our blood vessels, which can lead to a whole bunch of things, heart attack, stroke, peripheral vascular disease, gangrene. It also is potentially tumorigenic, and there's some strong association data, mechanistic data showing that it may have a role in cancer formation. It also impairs vitamin D production, and it's a fat storage hormone. So if we can get our insulin levels down, if we can make our cells insulin sensitive rather than insulin resistant, then that can only be a good thing. And how do we do that? Once again, by the dietary changes we talked about before, by minimizing our consumption of sugar, particularly fructose, and minimizing our consumption of seed oils. Both of these things can independently give rise to insulin resistance in the body. So insulin resistance is the core metabolic dysfunction which we have to focus on. Unfortunately, we focus on, as medical practitioners, often the sugar level in the blood, the fasting blood glucose level, but that only starts to rise quite late in the piece. So we're better off looking at fasting blood insulin level, which can, in people who are metabolically dysfunctional, will start to rise at a much earlier stage. And so that's what we should be focusing on.
You use the word remission. We've talked about the word remission several times, and it's and you said 1 in 100 of your patients who came to you via a GP or an endocrinologist, the people who are diagnosed with diabetes isn't the first stop ophthalmology, is it? I mean, it's usually GP and endocrinologist. And 1 in 100 had no idea that remission was even possible. And in my experience, and we've interviewed a lot of doctors, most doctors will repeat that, parrot that to their patients until they themselves get a diagnosis of type 2 diabetes. And many will go down the path of medication and follow the party line. And others will go, hang on, maybe there is another way, and they have an epiphany.
Yes, absolutely. And I myself had an epiphany. And not only did I, as I mentioned back in early 2020, when I started reading about this and realizing, you could actually put type 2 diabetes into remission using change in diet. Around about that time, I had some low backache, and I had a scan of my abdomen just to make sure I was nothing nasty going on there. And I found out that, in fact, I did have something nasty, which was a fatty liver. And a fatty liver is also a significant sign of metabolic dysfunction. And so I actually had then a significant driver for me to want to turn around my metabolic dysfunction. And I did that. I really started back in early 2020 by reducing my consumption of ultra-processed foods and all the foods that we talked about before. I look back at my diet, which was pretty appalling leading up till 2019, 20, it was pretty appalling. But over the last couple of years, I had an ultrasound done again, I think a year ago, and I've reversed my fatty liver. And there's no question changing your diet can actually, we're seeing this, plenty of studies also showing this, but I was able to turn around my fatty liver and completely improve my metabolic dysfunction. Fortunately, not too late. I think one of the critical things that I wanted to be aware of was, okay, if I've had this bad diet for so long and I've had a fatty liver, how are my arteries looking? So I actually went and had a coronary artery calcium score last year, which was all clear. I had a 0 sign of coronary artery calcium.
Wow, that's good. That's very good.
So fortunately, I caught it in time, as so it seems, but unfortunately, not so many people are lucky. And if you look at the fact that over 2/3 of Australian adults and a quarter of our kids are overweight or obese, that means the majority of us are metabolically dysfunctional. The majority of us will likely have insulin resistance. The majority of us are looking down the barrel of chronic disease.
Hi, Dr. Ron here, and I want to invite you to join our Unstress Health community. Now, like this podcast, it's independent of industry and focuses on taking a holistic approach to human health and to the health of the planet. The two are inseparable. There are so many resources available with membership, including regular live Q&As on specific topics with special guests, including many with our amazing Unstress Health Advisory panel. Now, we've done hundreds of podcasts, all worth listening to, with some amazing experts on a wide range of topics. Many are world leaders. But with membership, we have our Unstress Lab podcast series, where we take the best of several guests and carefully curate specific topics for episodes which are jam-packed full of valuable insights. So join the Unstress Health community. If you're watching this on our YouTube channel, click on the link below, or just visit unstresshealth.com to see what's on offer and join now. I look forward to connecting with you. Well, I think the statistic is something like half the population have at least one preventable chronic degenerative disease. So that is quite sobering, whether that's exactly right or not. But a lot of people are not well, if the evidence is anything to go by. You've mentioned lowering sugars, fructose, seed oil, and all of this, but it comes down to what is referred to often as a low carb diet. And low carb means different things to different people, doesn't it? Like, for example, dietitians, qualified university-trained dietitians will say, 310 grams of carbohydrate a day is pretty okay. That's fine. And so a low carb to them is go to 200 grams of carbohydrate a day. What does low carb mean to you, who has explored this in more detail?
Yeah, so low carb, and I think probably the best term is low carb healthy fat, because yes. I think a lot of the messaging that we've heard for the last 50 years is that we should reduce our intake of saturated fats and foods containing a high level of saturated fats. And in preference, we should be consuming polyunsaturated seed oils and margarines, which, as I've said to you, are actually not a healthy thing to be consuming.
Ironically, James, that was a very big policy from the Heart Foundation for many years, recommending exactly the seed oils that cause inflammation, are good for ultra-processed food on the shelf in the supermarket, but the Heart Foundation was recommending that. Sobering. I had to throw that in.
Yes, it is. And if you realise that 62%, I think at least, of Americans, 62% of the calories of their diet are ultra-processed food, over 50% in the UK diet. I suspect we're close to 50% here. We haven't had a look at those statistics for a few years now, but I suspect nearly half of what we're consuming are ultra-processed foods. And it's really driving this metabolic mayhem that's present in our society.
But low carbs again.
Yes,
let's come back to what is low carb.
So low carb healthy fat.
Healthy fat, yep.
A ketogenic diet is a type of low carb healthy fat diet. And another encompassing term that we're using more and more frequently is therapeutic carbohydrate reduction. Basically reducing your carbs in a therapeutic way to try and turn around the metabolic dysfunction. So it's quite a useful term, but it doesn't incorporate the seed oils, the healthy fats that we should be focusing on. So if we look at low carb, it's less than 130 grams of carbohydrates a day. If we look at a ketogenic diet, I think it's at least lower than 50 grams of carbohydrates a day of carbohydrates. Some would say even less, 20, 30 grams of carbohydrates per day. It forms a ketogenic diet. That's what we should be focusing on. Certainly, if I had type 2 diabetes, I would be going for a ketogenic level of carbohydrates in my diet. If I had pre-diabetes, I'd certainly be going low carb, less than 130 grams. And if I was metabolically dysfunctional, like I was, if I had a fatty liver or insulin resistance like I had, then I would at least go low to medium carb. And I would say that for the most part, I'm low to medium carb these days. So I have a sort of a range of carbohydrate levels which certainly work for me. And some would say that we should be, you have the carnivore movement who say that we should avoid all carbs and plant-sourced foods completely. And you have the vegan movement who say that we should avoid all animal-sourced foods. But I'm a happy omnivore. I like being an omnivore. I like the variety of foods that omnivorism gives you. And so that's my happy place, I suppose.
I remember Gary and Belinda Fetke used the term they are vegetarians who supplement their with meat, vegetables, with meat and dairy and cheese and all of that. So I like that approach too. I think it's interesting when people have been bombarded for so many years with the low fat idea and then they hear the low carb. I think what is particularly challenging is when they want to tick both boxes. I'm going to be really super good. I'm going to go low fat and low carb. I think that's challenging, don't you? Oh, this is why the healthy fats is important.
Absolutely. It's very, very difficult. And if you look back to the messaging, which has been around for the last 50 years, and it comes off the back of a corrupt history and a fraudulent science, but ultimately in 1980, the dietary guidelines for Americans were released, which recommended reducing our fat intake, particularly saturated fats. Now, when you take fat out of a food, you take out its ability to satiate you, to satisfy you. You also take away the flavor of the food. So something had to replace that, and that became carbohydrates. So this low-fat, high-carb dietary recommendation, seeded dietary advice across the planet. To this day, we have in our dietary guidelines a recommendation, which is a high carbohydrate eating pattern. And it's clearly when the majority of us, whether you could argue whether this dietary guideline advice is causing this metabolic dysfunction, but certainly if we realize that significant proportion of our population have metabolic dysfunction, then so they're insulin resistant. And if you're insulin resistant, it means you're unable to process the glucose load entering your body. And if you realize that most carbohydrates break down to produce glucose, you are glucose intolerant, by default, you're carbohydrate intolerant. The last thing we need to be doing is consuming more carbohydrates. So our dietary guidelines have got it all wrong. We have to move away from this recommendation, this high carb recommendation. And to be fair, on the dietary guidelines, they actually state in the early pages that these guidelines are for healthy Australians. But you realise the majority of Australians are not healthy, so these guidelines are not appropriate for them. But they're being used by bodies to recommend to people with type 2 diabetes how to eat. So the Royal College of GPs recommends people with type 2 diabetes should eat by the Australian dietary guidelines. Diabetes Australia also echoes that advice. Even in the pre-diabetes section of their website, they recommend people should have this eat by the recommended dietary guidelines advice.
Yes. It's interesting too, because a few months ago we had the honour and the privilege of talking to Dr. Michael Mosley, who sadly, as we both have reflected on, has tragically died. But Michael championed the Fast 800, and that was very much a low-calorie approach. And I asked him, well, the problem with low calories, from my personal experience, is that you get hungry, whereas low-carb healthy fats, you don't. You would agree, I'm sure you would agree with that.
Yes, an 800 calorie a day diet is essentially a starvation diet, and it's not sustainable. It's not enjoyable either. As you say, the low-carb healthy fat diet is both enjoyable and sustainable. I've been sustaining it for several years now and quite happily. So, yeah, there's no question about that. Having said that, so the 800 calorie a day diet, and there's a study out of the UK called the Direct trial, has shown that it can put type 2 diabetes into remission. It's one of only 3 clinically proven methods that can put type 2 diabetes into remission. One is the low-carb healthy fat diet we talked about already. One is the very low-calorie diet, which is the 800 calorie a day diet, which essentially is a low-carb diet, and also bariatric surgery. So you would never obviously start someone off on a bariatric surgical approach, but it is there as a modality for patients who are really struggling. So my strong feeling is that we should be recommending patients start on a low-carb healthy fat diet using real food, using natural food. The 800 calorie a day diet often relies on ultra-processed foods, or what I prefer to call ultra-processed food like substances, soups and shakes. And so even the Direct trial, we're starting to see that the people that can sustain that is starting to drop off. So why not start with a real food diet in the first place, which is the low-carb healthy fat? It's certainly my recommended approach, and it's much more enjoyable. I think if you start off on this 800 calorie a day diet, it might be okay to get things rolling with then moving towards the low-carb healthy fat diet.
Yes, which brings us to a discussion about Defeat Diabetes, which both I know you and I have been great supporters of since its inception, and you are an ambassador for that. We've had Peter Bruckner, who is the founder of that, a world-famous sports physician, on, and something really exciting, and I congratulate Peter and yourself on this, has happened in Australia, and it's a global first. Could you just share that exciting thing with our listener?
Sure. So Peter Bruckner's developed a platform called Defeat Diabetes, which is a way of guiding patients through their journey to potentially put their type 2 diabetes into remission. And they've just signed an agreement with Diabetes Australia to make this accessible to their membership. So that's super exciting. But there's a really interesting history leading up to this point. So I mentioned that we were able to get remission into the National Diabetes Strategy. On the back of that, I started communicating with my patients. On the back of that, I was starting to get some pretty unpleasant letters from endocrinologists in South Australia who are managing these patients with me. And I was able to respond to their rather hostile letters with, science-based arguments. But then I thought, gosh, let's get the endocrinologists in South Australia together with the low-carb practitioners and just have a round table and just address their concerns. What is troubling the endocrinologists so much about this? So we held that back in, when was it? It was sort of later in 2022. We had this roundtable meeting with the endocrinologists and the low-carb practitioners, and it was a rather unpleasant meeting, actually. But at the end, I was able to encourage one of the endocrinologists and one of the low-carb practitioners, so Dr. Steve Stranks and Lorraine Lawless-Smith, who I mentioned before, and they sat down together, and over the next year, they wrote guidelines for therapeutic carbohydrate reduction to help put type 2 diabetes into remission for patients. And that was published earlier this year. It took a while to write it, but that was released early this year and subsequently endorsed by the Australian Diabetes Society and also endorsed by Diabetes Australia. And on the back of that, Diabetes Australia was having conversations with Peter Bruckner and his Defeat Diabetes platform. So this is all rolled along nicely. And what's happening now is that about early last year, I had a meeting with Dietitians Australia saying, okay, it's time to embed this into your training of your dietitians, also into continued professional development for dietitians who are out in the workforce. And they wanted to wait till the guidelines were written. And as I said, it took the best part of a year. And then early this year, I met again with Dietitians Australia, with the leadership there. And I said, okay, these guidelines are out now. What are you going to do about it? And so we have now created a 10-module course on metabolic health called Essentials in Metabolic Health, which we are going to be delivering to Dietitians Australia a little later in the year. So super exciting. Again, if we can get, and I know there are a lot of dietitians waiting to have exposure to that, understanding that the science and the practice behind that. So that's going to be happening. And what we'll see is a huge shift. We have 8,000 dietitians around the country who hopefully will slowly take this on, both at the undergraduate and the postgraduate level. We've also, Peter Bruckner has been in discussion with the Royal College of GPs to inject this into GP postgraduate training. And I've been in discussion with the group, the actual group that's hosting the course for dietitians is called the Australasian Metabolic Health Society. This is a newly formed group which gives legitimacy to this whole process. And so the Australasian Metabolic Health Society, in conjunction with Peter Bruckner and his Defeat Diabetes group, we've been chatting to a number of the deans of medical schools around the country over the last few months, trying to embed this into medical school training, because it really all has to happen at once. If we're going to have dietitians suddenly doing an about face on the recommendations to the way that their patients should be consuming food, then this also needs to be critically aware by the GPs, and so that, because it often involves deprescribing, demedicating patients. So, and also as medical students who are coming out into the workforce also need to be aware. So this all has to happen at once, and has to happen rather quickly, because otherwise it's going to be chaotic out there.
Well, all of that sounds like a wonderful initiative, and I just did a workshop recently, and there was a fellow in the group whose wife was a dietitian, and he was type 2 diabetic, and he was just packing away at the tea breaks, putting away all the cakes and the scones that were out there. And I said to him, and he said, "No, my wife said you can't. Remission is not possible." But for those people that don't want to wait for the 10-module doctor training to occur, or for the year or two that it may take, people can just log on to Defeat Diabetes and within a week or two start making significant changes. So it's not that complicated, really, is it?
No, and I would suggest that they need to do it in conjunction with their GPs or their managing endocrinologists or physicians, because often, as I mentioned before, I had a patient who came off insulin within a couple of weeks. So it can actually, if you suddenly drop your carbs, you're going to have to drop your insulin, and it can actually be a little dangerous. So definitely do it in conjunction with your overseeing medical practitioner, no doubt about it. So, yeah.
Yeah, interesting. That importance of, if you are on that medication. And I'm guessing, would that be the same with metformin as well? If a lot of people are on metformin, that's not quite as sensitive as being
No,
on one
that's right.
time you get.
Insulin is a critical one because they can suddenly become hypoglycemic, and that can be potentially dangerous. And the SGLT2 inhibitors, and there are a number of those, can actually can be problematic. And so a number of the diabetes medications that patients are potentially on can be problematic when you are undertaking this therapeutic carbohydrate reduction. Another great opportunity is through Low Carb Down Under. And Low Carb Down Under has a directory of practitioners state by state around the country, dietitians, nutritionists, GPs, specialists who can help guide patients through this process.
Yes, and they have a terrific resource of YouTubes that have had millions of views, and some terrific science-based. You want the evidence. Well, Low Carb Down Under, we've had Rod Taylor, and he's done a tremendous job there as well.
Absolutely. And actually their conference is coming up. I think a little plug for their Low Carb Down Under conference. I think it's in September in Melbourne this year. So if anyone is interested in going along to that, it's one of the most, it's the single most positive and uplifting conference I've ever been to. And as I say, I've been in medicine for 40 years, been to plenty of conferences, and to be at a conference where you have GPs, specialists, talking about these extraordinary results that they're seeing in their patients. And you have patients also getting up and speaking and talking about the extraordinary turnaround in their metabolic dysfunction that we're seeing. It's super, super exciting, super uplifting. It's hard not to be a little bit evangelical about it, because it's such an exciting thing to witness.
Well, I think actually medicine, the practice of medicine, one needs to be a little bit evangelical, because I think it's very much got bogged down as a conduit to a very successful pharmaceutical industry and a very poor public health outcome.
Yeah.
And I think we have the potential to turn that around and not only improve our patients' lives, but our practitioners' mental health. That's a win-win as far as I'm concerned.
Absolutely. And as we were discussing before, we are taught in medical school to medicate patients. We go to conferences throughout our life, often significant sponsorship by the pharmaceutical industry. I myself have been sponsored to go to conferences around the world by the pharmaceutical industry. So we, in essence, brainwashed that pharmaceuticals are the only way of dealing with these diseases. But it's critical to realise that many diseases linked to insulin resistance can be turned around by quite literally a change of diet. And I think this is the problem that I had, was that when you are taught to medicate, you don't think of the alternatives. It doesn't mean you're acting necessarily in a corrupt way, although certainly there are corrupt circumstances, but it just means you're not aware of the alternative, which is actually a dietary change. And it was only because I read Jason Fung's book that I became aware of it. So I've been encouraging all of my colleagues to explore this different alternative path.
Yes. No, I think that's an important thing to say, and I would agree with you that I know many practitioners who practice, using pharmaceuticals to manage their practice, and I know many integrative doctors and low-carb doctors, and I think the thing they both have in common is they want the very best for their patients. There's no question about that. I don't think there's anything corrupt about it. I mean, I think the way the information is delivered to them, I think this is a story, as you are a testament to, that is very easy to miss, but once you hear it, very difficult to ignore. So I think that's part of the problem.
Absolutely. And this continued messaging, and we're seeing this, the whole narrative has become, for many years, this messaging that saturated fat is actually bad for us, which to this day, there is no strong evidence at all to suggest saturated fat is bad for us. There was a great systematic review in the Journal of the American College of Cardiology back in 2022, which exonerated foods that contain natural saturated fat, such as whole fat dairy, eggs, red meat. The other thing which has become, the other dietary recommendation which has become so ubiquitous in our society is red meat. The red meat causes cancer specifically, or particularly colon cancer, red meat causes heart disease, red meat causes type 2 diabetes, and all of these significant health bodies are giving advice to their membership. So the Heart Foundation of Australia, all over their website, red meat causes heart disease. The various cancer council, red meat causes cancer. Type 2 diabetes, also Diabetes Australia released a story in their Diabetes Management Journal last year, written by a dietitian, suggesting that type 2 diabetes was caused by red meat. So we're just seeing this ubiquitously, and it's when there's no strong evidence at all to suggest that red meat is actually bad for us. How can the food that we evolved to consume be causing this modern epidemic of chronic disease? Surely it is the modern foods that we're consuming, particularly the industrially created, ultra-processed foods that we're consuming now as at least half of our diet. Surely those are the things that are causing the problem.
I think your key word there was the natural foods, because while red meat, and I'm a great supporter of eating meat, but not all meat is equal, and food that is grown naturally, grass-fed, grass-finished, is not only good for the animal, not only good for the soil, not only good for the planet, but it's good for us as well. Whereas animals that are in cages, in feedlots, in that environment is unconscionably bad for the animal, bad for the environment, it's bad for our health. So when people talk about red meat, I think we are literally talking about two different beasts. And this is more nuanced as well.
Yes, so this is a whole discussion in itself. As Diana Rogers, author of Sacred Cow, says, it's not the cow, it's the how. So it's the industrialization of the ruminant and animal source food production, which is abominable. Fortunately, only about 4% of cattle in Australia are finished on feedlots, as far as I'm aware. But also the industrialization of the monocropping, which is also devastating to the environment. So this has to be a balanced discussion. I mean, it's not, it shouldn't be a one-way attack on red meat and red meat production.
No. James, I've been so looking forward to catching up with you, and I just applaud you and Peter and Defeat Diabetes and all the advocacy and what you've achieved. I truly believe is one of the biggest breakthroughs in public health globally for the last 50 years. So thank you so much for everything that you're doing and continue to do.
Thank you, Ron. It's an absolute pleasure. And if we can see this epidemic start to turn around, then I realise my job will be done. So it's an exciting thing for me to be a part of. And it's on the back of a bunch of work that so many people are doing in this space. And you mentioned the FETKIs. So we talked about the FETKIs earlier. They were pioneers in this space, but there's a whole bunch of professionals and working in this space that I've learned from. And I've just been lucky enough to have that platform of Australian of the Year that gave me that access to be able to make these changes. So it's certainly exciting times. There's a lot of work that's ahead. And if you realise, we talked about remission as a strategy for patients with type 2 diabetes, but unfortunately not everyone will be able to do that, and there's a variety of reasons why that might be. But some of the longer-term studies, the VERTA study, for example, showed that about 50% are still in remission at the 5-year mark. Okay, what about that other 50%? What's going on with them? So that's, I think, a really interesting thing to explore. But if you realise that type 2 diabetes is strongly associated with food addiction, you have an addictive food, ultra-processed food. The addition of sugar makes it addictive. And you have an industry, the ultra-processed food industry, the sugary drinks industry, who are preying on the addictions of people, and often vulnerable people. Then you realise that this is something that needs to be addressed as well. So there's a lot of work to be done. But thank you.
Well, thank you. Well, as I said at the beginning of the program, if James received an Australian of the Year award for his work for the Site for All, the social impact organisation that he has championed for over 20 or more years, he will almost certainly, I believe, should be up for another Australian of the Year award along with Peter Bruckner, because what they have been championing, and as you heard in that program, almost breathtaking, really, isn't it? I mean, addressing the cause. Now, I wrote about this in my book. I've talked about it various times in this podcast. When Diabetes Australia was celebrating its 75th anniversary, it issued on its website 10 steps for living life with diabetes. And step number 1 was breathtakingly to include carbohydrates in every meal and to stay on a low-fat diet. Now, I realized that the key word there was with diabetes, because if you wanted to live your life with type 2 diabetes without any chance of remission, then you would have followed the advice of Diabetes Australia and eaten carbohydrates with every meal, stayed on a low-fat diet, kept on your medication, and you would most certainly have lived the rest of your life with diabetes, type 2 diabetes. However, if you are wanting to overcome type 2 diabetes and eliminate that from your life along with the medications and all the health risks that go with it, then you would not have followed that advice. But I must take my hat off to Diabetes Australia and their new CEO for collaborating, for being brave enough to collaborate with Defeat Diabetes to actually address the cause. And it's quite breathtaking to hear James's story about their meetings with endocrinologists who generally are involved at the front line, along with GPs, of course, at managing type 2 diabetes, and to hear the resistance for this. This is what I have said repeatedly, and that is ignorance is a wonderful driving force to keep us learning. I mean, I've been in healthcare for 45 years, and the more I learn, the more I realize I have to learn. But when ignorance is combined with ego, arrogance, and hubris, and worst of all, formulates public health policy, then we have the terrible health outcomes in preventable chronic diseases that we do today. And you may well have already consulted with such an endocrinologist. But that is the reality of modern medicine. But when we have people like Dr. James Muecke and Dr. Peter Bruckner and organisations like Defeat Diabetes, and I would add Unstress Health as well, then we have some hope. And that hope is there. And I see it as one of the greatest public health initiatives, and I congratulate Diabetes Australia for their collaboration. We will have links to Defeat Diabetes in our show notes. We will have links to Unstress Health. I encourage you to join that community. This is an empowering story of prevention, which is what we are all about. I hope this finds you well. Until next time, this is Dr. Ron Ehrlich. Be well. Feeling stressed, overwhelmed? It's time to unstress your life. Join the Unstress Health community and transform stress into strength. Build mental fitness. From self-sabotage to self-mastery. And together, let's not just survive, but thrive. Expert-led courses, curated podcasts, like-minded community and support, and much more. Visit unstresshealth.com today. This podcast provides general information and discussion about medicine, health, and related subjects. The content is not intended and should not be construed as medical advice or as a substitute for care by a qualified medical practitioner. If you or any other person has a medical concern, he or she should consult with an appropriately qualified medical practitioner. Guests who speak in this podcast express their own opinions, experiences, and conclusions.